Welcome to Virtual Abilities 2023 Mental Health Symposium. We hope you will enjoy your time with us today and that you learn a lot about how self-identity interacts with mental health. Just a gentle reminder, all of our presenters are new to Second Life. Please be patient. Hold your thoughts and questions until they're done presenting because they need to concentrate. Thank you, and now Andy is going to introduce our first speaker.
Everybody hear me okay? Okay, good. Good morning, everyone, and thank you, Gentle. I would like to also welcome all of you to Virtual Abilities 2023 Mental Health Symposium. I am Andy Cooper, a retired educator for over 30 years and was guardian to my sister who had cerebral palsy. I have been in SL for over 19 years, pretty much since it began. I enjoy dancing with Muse Dance Troupe, exploring photography, and helping others. Come on. Today, I would like to introduce Dr. Joanna Fox. Dr. Joanna Fox is a social work academic and expert by experience. She is an associate professor in mental health recovery at Anglia Ruskin University in Cambridge, England. The title of her speech is Mental Ill Health and the Recovery Processes. She shares her personal experiences. I'm sure you all know this, but please hold your questions or comments to the end of our presenters so we do not interrupt. Welcome, Dr. Joanna Fox. The floor is yours.
Okay, please forgive me while I move to the podium. Forgive me, I'm not very good at this.
You're fine. Just right click on it, choose sit.
Great. Can I see my screen? Can you see? Yep, great. So, hello everybody. It's a real privilege to be with you today, and I would like to thank Gentle, Mook and I Sky, among others, for inviting me to this wonderful experience in Second Life. So thank you very much for giving me the privilege of being able to come to you and talk to you today about my own experiences of mental health and the recovery journey. It's my first time in Second Life, so I'm very excited to be here and really appreciate the opportunity. So thank you very much, and I will start. So I'm going to talk a little bit today about mental health and the recovery journey. I'm going to talk about my own experiences of mental health as both a person who's used services and also as an academic, and how these two experiences come together. I'm then going to talk a little bit about how my experiences reflect on the recovery model and then relate it to recovery in practice, such as shared decision making in mental health care and treatment. So thank you very much, and I will start now. So I'm going to start by telling you a little bit about my own journey of mental ill health and becoming diagnosed with the label of schizophrenia, which I know many of us contend against and notice the stigma associated with the label of schizophrenia. So when I was about 18, I went to work abroad in Germany. At the time, I was living in Cambridge, England. I went for a gap year, what we call the study year between school and university. I was quite naive, quite inexperienced, and I kind of fell in love with somebody who wasn't in the least interested, but because I I was starting to have strange ideas and strange beliefs. I didn't really understand that he wasn't interested, but that was due to the beginnings of my mental ill health and the beginnings of not really understanding the world as it was. I was quite isolated. I had few friends and very little stability. And I think many of you who have had mental health will know that these are poor mental health or poor mental well-being, will know that these can be something which can impact on mental well-being. So I went to university. I came back from Germany in the August of, it must be 1990, and started at university in September 1990. At that time, I didn't really want to leave Germany. I was convinced this man would love me. He didn't. He probably had very little idea of what I was thinking or what I was feeling. And it was just my own thoughts and my own beliefs that were making me believe something different. So I started to work very hard and had I had increasing anxiety and stress. And I was like this rubber band that kept stretching and stretching and stretching, and my anxiety and stress increased. And on top of that, I was starting to feel ideas, what we call paranoia, so ideas of suspicion, strange ideas that people could see inside my head. So I would walk down the road and I would believe that people could see into my head, that they could see the thoughts that were going on in my head. And also I lost a lot of weight, and I firmly believe that connections with physical changes in the body and the way the body works also impacted on my mental health, not only through a different identity as well, from being a person who was overweight to being a person who was slim. And I think these all impacted on my mental health. And I started to have feelings of growing fear and terror. I started to get ideas such as strange beliefs. I started to believe that I had special powers, that I could communicate through walls, and I would spend all night chatting through my head to the people I believed who were awake, chatting to me in their rooms through their head. They were probably fast asleep, and I would have really in-depth conversations with them till 5 o'clock in the morning through the walls, believing they could hear what I was thinking, that I could communicate telepathically. And I'm sure many of you will know that sleep and relaxation and calmness are really important for good mental health. And for me, it was really tough because I wasn't sleeping, and I was like this rubber band that was stretching and stretching. And and at the time in the UK, we had the political troubles in Northern Ireland, which I'm sure you may have heard about. It's 25 years since there was a cessation of violence in Northern Ireland. But at that time, for me at university, the troubles were very violent in Northern Ireland at the time. So I thought I was going to save Northern Ireland from the political troubles. I started to believe that I was going to be recruited by the CIA or the FBI. And if you look at all these thoughts in separation, they seem rather strange. But to me, there was a logical whole to these beliefs, which confirmed each other in different ways. And I started to ask for help because I didn't know what was going on. I went to see the GP. In the UK, we have primary care where you go first to a doctor, and they will give you basic treatment to start off with. After that, they refer you to more specialist services. But I went to see my doctor, who's a general doctor. she gave me some tranquilizers, and they didn't really help because I was starting to go down a path where I was getting quite unwell. I went to see a priest because I believed I was possessed. At this time, I was starting to hear voices and see strange things that weren't there. And in the 1990s, there was much more information on the television about demon possession than there were about the symptoms of mental ill health, and people having strange thoughts or hearing things. So I was starting to believe I was possessed. And at university, I had a personal tutor, and she noted some problems. So I was referred to see the university doctor, and then I saw a psychiatrist about a week later. That psychiatrist didn't communicate very well, wasn't very easy to communicate with, felt like this distant authority figure. But they obviously recognized the symptoms of mental ill health and gave me the option to either take medication in the community or offered me the opportunity to go to become an inpatient in a hospital ward. And for me, I felt terrified at university. I felt that I was isolated. My parents had come up to university, so this was about 300 miles from their home, and they came up and stayed with me. And I know this, talking to them afterwards, this was one of the most terrifying times of their life. I remember going in the car with my mum at one point and believing that I could communicate through my head with her. So she was trying to ask me questions and she was trying to talk to me, and I wouldn't talk with my mouth because I believed that I was telepathically talking to her with my head through to her head. And she, at that time, she was, and I know how upset and confused and distressed she was as well, and didn't know what was happening to her daughter. So for the family, it can also be very difficult supporting people who are experiencing mental distress. So at this time, my mum was staying up with me at university, and I went into hospital. I remember the night before I went into hospital, crawling into her bed with her because I was so frightened and so terrified. I was like this child who was absolutely terrified again. But then I went into hospital and I started to take medication. The medication, as anybody who knows who has ever taken mental health medication, was very very sedative. It was like a hammer on my head, and it just sedated everything. But for me, that was better than the terrifying thoughts that I had and the terrifying voices in my head and the things that I was seeing. So for me, that kind of experience of being, and I call it I don't know what you would call it in America, but in England we say zonked out. So very sedated, very calmed down. Zonked out was for me a positive experience rather than a negative experience. And I started to think my way out of my mental distress. So other patients could also chat to the news presenters on the TV. So why, if I believed I was special and I could talk to the news presenters and they could also talk to the news presenters through their head, were we special, or did we all have strange ideas? And I started to think about this. Was I just a special one, or were they also special? And I started to think this through logically. And this was something that for me was the way back to my recovery. So I thought in a logical way, was the hospital looking after me and other special people, or were we all just mad? And I choose this word mad because I identify with the movement Mad Pride, which talks about people being mad and proud. So people having mental distress and at the same time being proud of their identity and who they are. So for me, madness is something I would prefer rather than saying I have the diagnosis of schizophrenia, because the idea of schizophrenia, I think, is even more stigmatizing than the idea of madness. So the seeds of my recovery was that I chose to believe I was mad. So the medication had really bad side effects. As I said, I was very sedated. I had a huge weight gain of 6 stone in 1 year, and I lost all my concentration. So the medication worked as a whole body sedation rather than just selectively calming things down. It was a whole universal sedation of being sedated and zonked out rather than just working on selected parts. But the medication for me was successful because it quietened the voices and softened the paranoia. And for me, that was just some sense of relief. So there was a long journey of recovery from me. What were the important things that were important in my own journey of recovery? So I had support from family, which I'll talk about in a second. I continued at university, but commuted home every weekend. Following this mental distress, this mental health breakdown, I had no concentration left. I couldn't sit still. I couldn't think clearly. I couldn't think in a fluent way. All of my thoughts were very staccatic and very abrupt. I couldn't flow with my thinking. I had no concentration. So I had a choice. I could either stay at university and have the identity as a student, or I could go home and take on the identity of a patient. And for me, although university was really stressful, it was really hard, and I found it extremely scary, for me it was better to have a structure to my day, to have some kind of belief that I could achieve, rather than just to go home and have lots of time that needed to be filled that was empty time. So I had to relearn to structure my day. When I woke up in the morning, it would be terrifying because I would have a whole day in front of me that needed filling. It was empty time, which is really scary. So I had to have quite a stiff structure to my day so that I didn't feel so terrified by the day. I had no concentration. For me, for the first 3 or 4 months following my hospital stay, I found it really difficult to sit still, and concentrating was really, really difficult. So I would sit at my desk, not doing anything, but just sitting there. So starting by sitting there for 2 minutes, then 3 minutes, then 5 minutes. So just building up that importance of sitting still and trying to build up concentration. My mind, and I'm sure my experience might be called a post-traumatic stress disorder these days, because that mind that had been so stretched like a rubber band was so stressed and stretched and anxious and so terrified that I think now it would probably be diagnosed as post-traumatic stress disorder. After that experience, I had continuing paranoia. I was very depressed, and then as these symptoms continued, I was diagnosed with schizophrenia. But I stayed at university. I completed my degree in 3 years. I got an honours degree. So I don't know how I managed, but I did. And for me, having and this is different for everybody, but I think a sense of spirituality is really important for people who are recovering. And for me, I had a faith, and it may be different for other people, and other people will have different beliefs. But for me, I had a faith, I had a Christian faith, and I believed that actually that had happened for some purpose. For other people, they may have a different spiritual belief, but I think recognizing what people find as important to their spiritual well-being is really important and key to their recovery. So believing that there was a purpose, that actually I could get through it, were really important for me and my recovery. So I had family support. My parents were very, very supportive. And I know for a lot of people, family members may be very helpful, but for other people, they may be less helpful. And family members may not be as helpful for some people. But for me, they were very helpful. However, I had a growing dependency on my parents, and I lost a lot of my independence, a lot of my own emotional sense of self, and I became very dependent on my parents, on my parents looking after me. I know my mum got very, very frustrated at the slowness of my recovery, and I remember her one day trying to get me to get up one day, because I was in bed and I wouldn't get up, and it was 10 o'clock in the morning, and she tried to pull the duvet off me and I wouldn't get out of bed, and I know she ran up to the top of the garden with a spade and hit a tree so hard that she was so frustrated and angry. And at the time we had little support from mental health services, and there was a realization then that a recovery was a long haul rather than a speedy journey. And I had to realize that actually recovery from a mental health breakdown and a diagnosis of schizophrenia would mean that things wouldn't be easy, and that I would have to be in there for the long haul. So it was a long journey then of what would happen. So what worked? For me, I stayed in education. I trained as a social worker because that linked in with my belief that there was some purpose to my illness, that and I'd always found education quite easy, but it was very, very difficult for me now. I was mentored by a professor who himself had his own experiences of mental distress, and he said that it was possible to be mad and to be a social worker, and that there was a place for being open about experiences in social work. At the time, there wasn't that place in social work practice, but I could find a place for myself where I could use my experiences to help and support other people. So mentorship was really important. Family support was also key to my well-being. Again, the religious belief that there had to be some reason for this and some way in which I could give back. And I also found cognitive behavior therapy very helpful for me. I know for some people it's not very effective, but for me it was effective, and I have had different kinds of talking therapies throughout my mental health journey. Most recently, I had about 3 years ago, I experienced acceptance and commitment therapy, which was really helpful for me, and is a way of which combines both mindfulness training and elements of cognitive behavior therapy. I had strength and growing resilience, and I had to learn to self-manage my own mental health. And something that was really important as well was people's faith that I could come back from the brink. And that was really key to my own recovery journey. And I'm talking at a place now which is maybe 35 years past my first mental health breakdown, my first stay in hospital. And I have learnt a lot of things. I did my Masters of Arts in mental health practice, and a PhD looking at what carers thought about the recovery process. And for me, these are key elements in my recovery, in allowing me to believe that there is a purpose, that I can help other people, that I can grow beyond those mental health experiences. At times, I still become paranoid. I still have problems sleeping, but I manage. And I have a very supportive husband and a wonderful daughter who's very clever and very assertive. So I would say that actually I have managed my own journey of recovery. But I know at the same time of my own recovery journey, I have limitations which impact on what I'm able to do. So Anthony describes the recovery approach in probably the most accepted definition of recovery. However, I think it's quite strange that the recovery approach is is something that's led by experts by experience. Yet Anthony was a psychiatrist, and this is probably the earliest accepted definition of recovery by a psychiatrist rather than by a service user, which I think is a bit ironic. So Anthony says that recovery is a deeply personal, unique process of changing one's attitudes, values, feelings, goals, skills, and or roles. It's a way of living a satisfying, hopeful, and contributing life, even with limitations caused by the illness. Recovery involves the development of new meaning and purpose in one's life as one grows beyond the catastrophic effects of mental illness. And for me, this really captures my whole journey, recognizing that I have limitations, recognizing that I can lead a hopeful and contributing life, recognizing that I have changed and that I have developed through this illness, and that actually the me I am now is not the me I would have been if I had not had experiences of mental distress. And Brown and Kandikira, who wrote, looked at this, they undertook research with people in Scotland, and they said that these elements are really important to the recovery approach. So they talk about the importance of hope and optimism, of self-acceptance, of ability to self-manage your own illness. They talk about the issues of stigma being a really negative part of someone's experience, and how powerlessness and removal of identity can really limit people's recovery and be barriers to their recovery. It also reflects on the fact that physical image and sexual identity can be impacted by medication. So I know that I gain weight because of my medication. I also have an increase in chances of getting diabetes because of my mental health medication. But for me, the medication is something that I have used as part of my own recovery journey that helps me to keep well and is something that I choose to take. And I think this is written by Ron Coleman, again, a person from Scotland, a service user from Scotland, who talks about the importance of recovery for himself. He says, recovery is not a gift from doctors, but the responsibility of us all. He reminds us that we need to become confident in our own abilities to change our lives, and that we can't be reliant on others doing everything for us. We must have the confidence to give up being ill so that we can start being recovered. I know that for a lot of people, recovery is something that is a negative word because it implies that they are recovered, that they're not on a journey anymore. And I know in the UK, another writer has talked about the word discovery rather than recovery. So talking about the journey of recovery being a journey of discovery, which has been important for some people. But for me, the concept of recovery was really important for my life and marked a changing moment when I learned about the recovery approach. So recovery for me is important because it emphasizes hope. It emphasizes support when and as needed. And for me, part of that, of my recovery, is control over my own medication, when and where I want to take it, and the support and experience of different talking therapies that work for me, and belief from other people from different backgrounds that I can do things, but also a faith in my own belief to be able to do things. And again, my own personal resilience and belief, and my commitment that there must be a reason for this, that actually this distress can only be, there must be a reason why I have this and why I'm living on this earth. And that for me was really important in my own journey of recovery. So in the UK, we are in the United Kingdom, in England, we talk about the importance of co-production. By co-production, we mean working in partnership between people who use services, people with lived experience, their carers, and professionals. And they say that co-production is really important in developing mental health services, that it needs to be also co-production with families and carers, as well as with people with lived experience. So that's really a really key matter in underpinning English mental health policy, which is about trying to promote co-production and working with people and respecting the rights of people to direct their own mental health, to be involved in developing mental health services. Again, sometimes it's a bit of lip service, so sometimes it's a commitment rather than something that happens on the ground, but it should be at the key and the centre of UK policy. Something that I've been involved with and helping to develop in mental health services in our region is shared decision making in medication management, medication treatment, and all different kinds of mental health treatment. SDM means shared decision making. Please forgive my use of abbreviations. So shared decision making is in a lot of European countries, as well as in Australia, and New Zealand and Asia. The NICE guidelines in England, and NICE says that actually in England it's really important that people, this is how they have issued guidelines which talk about that say that shared decision making should be at the centre of health and social care services. So the NICE guidelines, so these say how treatment and services should be operated, so that shared decision making should be at the centre of all care and treatment. And shared decision making is really important because mental health medication not only affects our mental health, it also affects our whole personality. Mental health medication can make us get bigger, get fatter. It can change our sleeping patterns. It can change our sexual drive. It has lots of implications for our health and our well-being. So medical decisions and medicine decisions are also personal decisions. And what shared decision making says is that there are two experts in any consultation. So I am an expert about me and what matters in my life, whereas the prescriber, the person who's giving me the medication, is an expert in knowing what the side effects are, what its effects are. So what shared decision making says is that the best decisions about medication are made jointly between the prescriber and the person who takes the medication. And it's all summed up in the idea, the disability movement, which says nothing about me without me. And so in simplistic terms, what it means is that decisions about medication can have a huge impact on their lives. Me, as an expert in knowing how the medication affects me, should be valued. My knowledge should be valued. And also, if I'm more involved in decisions about my medication, then I'm more likely to either take that medication or choose to take it when I choose it. So it can help to assist recovery and also improve the quality of life. So what needs to be in place for shared decision making to happen? There needs to be information about the side effects of medication, about how it's going to affect me, how it's not going to affect me. There needs to be assertiveness on and support for that service user, that person with lived experience, to be able to express their views, so that the prescriber, the person who's prescribing the medication, listens to the person with lived experience, and also the person with lived experience listens to the expertise of the prescriber. So there needs to be listening on both sides. Sometimes there can be helpful tools which help people to jot down, to write down what they want to say, so that they can remember what they want to say and they can be informed. And this can help people to get their views across. And there needs to be clear and shared goals and priorities. So finally, my final slide says what's recovery about? So for me, the things that helped my recovery were co-production. So recognising that I was an expert in my own care and that professionals should listen to me and should support me in my decisions. That empowerment was really important. And the experience that I had as a social work student, learning about the recovery approach, being mentored, were all about empowering me and enabling me to realise that I could have a place as a social worker in society, and that I could talk about mental ill health, and that there could be somewhere in which I could be both a social worker and a person with mental distress. So listening to people is really important in the recovery process and validating their experiences. So saying, yes, I understand what you're doing, I understand your feelings, and I believe that you are an expert in your own recovery process. So barriers, by the word austerity in the UK, we talk about cuts to public services following the 2008 economic crash. So following the 2008 economic crash in the UK, there was a huge cut to public services. And I don't know, many of you know about the English system of healthcare, but we have the National Health Service, which means that all British citizens can access the health service free, and it's of a good standard. We don't have we do have some private medical insurance, but most people access care through the National Health Service. So cuts to public services and funding have really impacted on the availability of mental health services. And professionals now often balance up the role of care and control. How much is it our responsibility to care for somebody and enable them to take risks, and how much must we protect them and support them so that they're not able to take risks or harm themselves? So risk management and assessing risk is really important to enabling people to live the fullest life that they can. And sometimes lack of services, lack of time, and lack of staff can be real barriers to recovery. So thank you very much. That's where I'm going to finish now. Thank you very much for listening. If anyone wants to get in touch with me, please feel free to email me. My email's there, and I'm very happy to take any questions if anyone would like to ask me any questions, or either through the chat or by speaking. So thank you very much for listening. I have a comment, if I may, of course. Sorry, let me have a look. Okay. Sorry, okay.
I can read that for you if you like.
Thank you very much. I'd appreciate that. Thank you.
We have a comment from Isabella. I have a sibling that was diagnosed bipolar. My sibling passed away several years ago. My sibling lived a life of ups and downs and as well tried numerous suicide attempts. I can't emphasize how important for family members to get therapy to help understand and cope as much as someone can with people with my type of mental illness. What I find sad is that in some countries that have to pay for mental illness and the supports, which I find extremely important for it to be free. So just a comment from Isabella.
Thank you, Isabella. So one of the things that I have done, because following my my own recovery journey, I felt that it was important to work with carers. So following my, after I trained as a social worker, I worked with carers in a carers development centre and provided information and support to mental health carers. So talking to them about my own experiences of recovery. And for my PhD, I developed a course on the recovery approach, which was delivered online to a group of carers, and it's been delivered about 3 times through different developments of the program. And one of the things I'm really committed to is developing recovery training for carers themselves, and that's something I've done a lot of. So if you search for me through Google Scholar, you should find some of my articles. If you'd be very welcome to have a look at them. So just have a look at Joanna Fox, and you might see some of the work I've done on developing recovery approach for carers.
We have a comment from Mook. Thank you so much for sharing your personal journey. I agree with Coleman that recovery is not a gift from doctors, but the responsibility of us all. Recovery is a path. but can also be a condition and may be lifelong. It may be disabling. With mental health, there is no final moment beyond which we can claim to be fully healed. I feel that the literature and design of accessibility is a concept that should be extended to the requirements of recovery.
I agree
And
entirely. Sorry, go ahead.
yes, and now Gentle has a comment as well and a question. Joanna, that was a very moving and totally convincing story and explanation of why shared decision making is so important in mental health recovery. Her question is, what is the role of family in co-production? Some of us don't have very supportive or understanding family. How can the process sort out if the family will be helpful or not in the recovery?
I think that's really key. I'm just trying to think. There's, oh, I just can't remember at the moment. There's there's a practice model that's been developed in Finland called open dialogue. An open dialogue is a process in which it seeks to get the it's almost like a circle of support. So professionals work with service users and their families, and they work with them. They don't talk, and any comments that are made about the person with lived experience are made all together in the group. So professionals don't go away and discuss care plans or care planning separately to that person. They don't discuss things separately with carers. Everybody discusses things in the group, and as a group, they learn to manage family dynamics. So the person with lived experience is able to invite their friend, their family, their supporters, and there's a recognition that everybody has a role in that recovery. And I think trying to enable people so I know that some family are abusive and some family are not helpful, and that wouldn't be an appropriate way to involve them. But sometimes family members don't always understand, and sometimes involving them through such a process may help them to become more supportive because they don't understand. And actually, beginning that dialogue can help people to share things and maybe move forward. Sometimes where there's been physical abuse, sexual abuse, where families have not been helpful, then obviously there needs to be a recognition that sometimes families are not helpful. We also have other practice kind of models called family group conferencing, which was developed in New Zealand and is a way of in child protection, and it brings together parents and others and significant others with professionals and sometimes young people if they're of an age, and they talk about some of these issues. And sometimes parents who are not helpful are also involved in these family group conference, so they're able to put their view across. But it's about sometimes it's about educating family members, but sometimes I do realise that family members are not supportive, and I think that's a balance that needs to be met.
Gentle says, it sounds like there is a big need for education all around, professionals, carers, family, and patients.
You're very right. You're very right, Gentle. Are there any other questions or comments?
Rhiannon says, thank you for your presentation and sharing your journey. As someone supporting family in their own mental health journeys, I have found helping as an advocate in the mental health care process, even if just speaking up, sharing medical history, etc., when the family member is in crisis. Thank you.
Thank you. That's very helpful. Thank you. Can I just can I use this moment just to thank Gentle, Mook, and Ice Sky particularly, because they're the people that I've met in Second Life, for their patience in showing me and inviting me to Second Life and supporting me through this. It's been an incredible opportunity just to enter into Second Life, and it's my first experience of Second Life, so I can just say it's been an incredible experience, a learning experience for me, and a real privilege to be involved. So I just wanted to thank the organisers of the conference for the huge effort that's obviously gone into working with their presenters, not only in a normal way, but in a kind of Second Life way as well. And I'm very grateful for the time that's been taken to help introduce me to Second Life, as well as I'm sure the time you've put in to help the other speakers as well. So thank you very much for that.
We also thank your daughter for her tech support.
Yes, my daughter attended with Gentle and helped me into Second Life, and then when it came to the weekend, she showed me again. She said, "Mummy, you can't do that. You have to do this. I can't do that. Slow down." And then Gentle reintroduced me to Gentle Life to Second Life as well. So thank you very much. So I'm happy to answer any questions. Otherwise, I'm very happy to give out my my reference list, if that would be helpful.
Yes, that is in the yellow box that is down front by the podium.
I just don't. So do I have to stand, don't I, and then turn around? Oh, done something. So I've lost where I. Oh, there we go. Ah, so do I click on it with my right click, and what do I do? Zoom in.
Touch it.
Ah,
Right click and touch it. And it will give you a list of references.
has it gone out? Did people get it?
Yes, it looks like people are managing to take it.
So thank you very much, and I would have loved to stay, but I've got to take my dog to the vet, unfortunately. So thank you very much, everybody. It's been a real privilege.
We hope you'll come back to Second Life.
I'd love to. Thank you ever so much. Bye-bye, everybody. Thank you.